with a presentation on professional program planning. So if you're interested in physical therapy, occupational therapy, veterinary medicine, physician's assistant, pre-med, pre-dental, pre-law, you're in the right spot. My name is Heather Ezell Wigand. I'm an academic advisor on the Southern Wake campus. My co-presenter behind the scenes is Ashlyn Reebok. She is manning the chat. If you have any questions as we're going along, feel free to put those in there. All right, so what are professional programs? I use that word a lot and people look at me like I'm crazy and they don't know what I'm talking about. So we've kind of hinted at it, let you know you're in the right spot, but what is a professional program first and foremost? Professional programs are programs of advanced learning to occupations that are each governed by a mandatory regulatory body. Members of these professions must complete licensing exams before they can actively practice and must keep their credentials current through additional education mandated by their respective regulatory body. Professional programs can span anywhere in length from 1 to 5 years and are generally started after the completion of a bachelor's degree. So here are our most common professional programs: medicine, dentistry, law, physician assistant, physical therapy, occupational therapy, pharmacy, and veterinary medicine. So undergraduate students who are completing their degrees with the goal of continuing on to a professional program greatly benefit from pre-professional advising. They are often referred to as pre-med students, pre-dental students, pre-law, etc. So let's talk about these fields individually. I think a lot of students maybe think they know what it means to be a doctor or a dentist or a pharmacist or a physical therapist, but maybe they don't really know and really don't know what it takes to get into a program like these. So medicine. What is medicine? It's a vocation characterized by a specialized body of knowledge of medicine that its members must teach and expand by a code of ethics and duty of service that put patient care above self-interest and by the privilege of self-regulation granted by society. So there are 154 MD, which is Doctor of Medicine, and 38 DO, Doctor of Osteopathic Medicine, accredited programs in the U.S. Programs are years in length, followed by a residency and potentially a fellowship. So generally about 4 years for medical school, then a residency, and many do go on to do fellowships, especially to go into specialty areas. Medical school applicants in 2020 reached 53,030, with a total of 22,239 applicants matriculating, which means that 42% of med school applicants for that year were accepted and enrolled at a U.S. medical school. This class of med students had strong academic credentials and a median undergraduate GPA of a 3.79. Enrollees ranged from 17 to 50, with 168 of those students being military veterans. Now, where can you go to school for medicine in North Carolina? UNC School of Medicine at Chapel Hill, Duke University School of Medicine in Durham, Wake Forest School of Medicine in Winston-Salem, ECU Brody School of Medicine in Greenville, and Campbell University School of Osteopathic Medicine in Lillington. All right, so now we've got dental medicine, the branch of medicine concerned with the preservation and treatment of the teeth and other orofacial tissues. It includes preventative measures and health education, which include but are not limited to oral hygiene, restorative procedures, prosthesis surgery, nutrition and digestion, and improved mental health from the control of oral and dental infections. Now, there are 68 accredited dental schools in the U.S., and the American Dental Education Association reported 10,965 dental school applicants in 2020, with 6,257 of those becoming first-time, first-year enrollees. It's a 57% rate of applicant admission and enrollment. Dental school typically lasts for 4 years, although there are some accelerated degree programs that may only take 3 to complete. Dental schools in North Carolina, only 2 of them, UNC Adams School of Dentistry at UNC Chapel Hill and the ECU School of Dental Medicine in Greenville. Law. So law is the discipline and profession concerned with the customs, practices, and rules of conduct of a community that are recognized as binding by the community. There are 199 law schools in the US that are accredited by the American Bar Association. The 2021 admission cycle produced a total of 71,048 applicants, which was a 13% increase from 2020. Median GPAs among the top 100 law schools in the country range from a 3.6 to a 3.99. Law schools utilize rolling admissions, and that means that they are programs that accept early applications on a continual basis until a set deadline. So apply early. Law is one of those areas where you don't want to wait till the deadline to apply, because once they reach the number of students that they're going to accept in a rolling admission period, they'll cut it off. So don't waste time in getting ready to apply and prepping for that application process. A traditional full-time JD program typically lasts for 3 years, although an accelerated JD program may only take 2 years to complete. There are several schools of law in North Carolina. We've got the UNC School of Law in Chapel Hill, Duke University School of Law in Durham, Wake Forest University School of Law in Winston-Salem, North Carolina Central University School of Law in Durham, Campbell University School, that's Medicine, the Elon School of Law in Greensboro. All right, so physician assistant. This is one that's becoming more and more popular and increasingly competitive. So a physician assistant is the medical professional that diagnoses illness, develops and manages treatment plans, prescribes medications, and often serves as patients' principal healthcare providers. They are licensed to practice with a physician supervisor. There are 277 accredited PA programs in the US. Gaining acceptance into PA programs is not easy. The overall acceptance rate of PA schools is 31.6%. So it's more competitive to get into PA school than it actually is to medical school. The average GPA of PA matriculants, who are applicants that gain admission and enroll, is a cumulative 3.6. Applicants have a median science GPA of 3.5 and a non-science GPA of a 3.6, a biology, chemistry, and physics GPA of 3.5. Most PA programs are approximately 26 months in length and award master's degrees, including classroom instruction and clinical rotations. Now, where can you go to become a PA in North Carolina? Got a lot of options. UNC Chapel Hill, Duke University, ECU, Wake Forest University, Gardner-Webb University in Durham, Campbell in Raleigh, Elon, High Point University, Lenoir-Rhyne University, Methodist University, Pfeiffer University, and Wingate University. All right, so physical therapy. Physical therapy is the healthcare profession primarily concerned with the remediation of impairments and disabilities, as well as the promotion of mobility, functional ability, quality of life, and movement through examination, evaluation, diagnosis, and intervention. As of June 2021, there were 247 institutions supporting 264 accredited DPT, which is Doctorate of Physical Therapy, programs in the US. An additional 60 programs are currently in development. Another extremely competitive program, the average acceptance rate of PT schools are 31.41%. Average GPA is again a 3.6, and many PT programs also separately calculate an applicant's overall biology, chemistry, and physics GPA. The traditional DPT program is 3 years. However, there are some that compress academic requirements into a shorter time span. So where can we go for physical therapy in North Carolina? Again, University of North Carolina at Chapel Hill, Duke, East Carolina University, Wake Forest, Gardner-Webb in Durham, Campbell University, Elon, Western Carolina, High Point, Methodist University, Winston-Salem State University, and Wingate. All right, occupational therapy. This is one I feel like students miss a lot and kind of lump in with physical therapy, and they really don't know what an occupational therapist does. This is the only profession that helps people across the lifespan to do the things they want and need to do through the therapeutic use of daily activities, occupation. OT practitioners enable people of all ages to live life to its fullest by helping them to promote health and prevent or live better with injury, illness, or disability. So students interested in the field of occupational therapy can actually pursue either a master's of occupational therapy or a doctorate of occupational therapy. There are 52 accredited DOT and 173 accredited MOT programs in the US, with the average GPA of admitted applicants ranging from a 3.5 to a 3.8. Occupational therapy programs are extremely competitive. Recent admission data reports 7,028 DOT applicants with 1,380 admitted and 34,135 MOT applicants with 6,835 admitted, an acceptance rate of about 20% for both. Masters of Occupational Therapy programs generally take about 2.5 years to complete, while the DOT programs take 3 years. Degree requirements can differ based on whether you want to work directly with clients as a practitioner or go into teaching and research. So where can you go for occupational therapy in North Carolina? ECU, University of North Carolina at Chapel Hill, Winston-Salem State University, Lenoir-Rhyne University, Methodist University, Wingate, and Duke are actually in applicant status. So they will be accredited OT programs in the coming months. All right, pharmacy, a profession of experts in the preparation, preservation, compounding, and dispensing of drugs for medical use. It aims to decrease healthcare costs and promote improved patient outcomes. So as of January 2021, there were 140 US-based colleges and schools of pharmacy with accredited professional degree programs and a total of 40,392 submitted admission applications. Aspiring pharmacists must earn a Doctor of Pharmacy, which is a PharmD degree. While admission requirements do vary by program, many require applicants to undergo at least 2 years of undergraduate study. Many programs also require a bachelor's degree. Pharmacy programs do differ in duration. The typical program requires about 4 years of study, while some schools offer those 3-year accelerated programs. First professional degree enrollment for pharmacy programs in 2020 ranged from 56 to 1,569 students per college or school. So our North Carolina pharmacy programs, we've got the Campbell University College of Pharmacy and Health Science, the UNC Ashland School of Pharmacy, High Point University, and Wingate University. All right, and veterinary medicine. So the branch of medicine which deals with the prevention, control, diagnosis, and treatment of disease, disorder, and injury in animals. There are 32 schools or colleges of veterinary medicine in the US that are accredited or pending accreditation. It typically, like med school, takes 4 years to earn the Doctor of Veterinary Medicine, and then is followed by a residence and again a fellowship to gain experience in specialty fields. The average GPA of admitted applicants at veterinary medical schools is between a 3.6 and a 3.7, with a 3.2 to 4.0 range. The number of applicants seeking admission to veterinary medicine schools for the 2021 admissions cycle rose 19% and totaled 10,273 applicants. It's a lot for 32 schools. Competition for admission is very competitive. The acceptance rate is typically between 10 and 15%. No surprise, the only North Carolina veterinary medicine program is the North Carolina State College of Veterinary Medicine. All right, so what do we know about getting into professional programs? Students who have the idea that they want to follow these tracks, what is it that they already know is involved? One thing is a prerequisite course. Professional programs generally agree on the basic elements of their respective pre-program education requirements. It's important to make sure that you're checking with your specific institution for their program's information. Though they generally do have an accepted group of courses based on the profession, it can vary by school. So as you should be considering multiple schools for professional programs, you need to be actively getting information from them, looking up prerequisite courses. And as you're planning and incorporating those courses into your undergraduate study, making sure that you're including differing courses at the multiple schools that you're trying to apply to. Law is actually the only professional program that does not have any prerequisite course requirements. It's probably no surprise that prerequisite courses tend to be very science heavy. Some of the tracks do involve a little bit more math, and then your occupational therapy is going to be a mix of your social and natural sciences. Exams. I think most students are relatively familiar with the fact that if they're going to go into some of these programs, they're going to have to take an entrance exam. Some have their own, others follow group pathways. Medicine has the MCAT, the Medical College Admissions Test. Dental requires the DAT. Law requires the LSAT. Pharmacies, the PCAT, Pharmacy College Admission Test. OT and PT programs require the GRE, the Graduate Record Examination. PA has required the GRE for years. Recently, the PACAT, the Physician Assistant College Admission Test, was developed, and more schools are moving to requiring that. And then for veterinary medicine, again, the GRE, with some schools also requiring the biology GRE. Okay, so we've gone over the stuff that we kind of know. We know more about the different programs and what they do, how competitive they are. What are some common myths that impact pre-professional students? Myth number 1, pre-professional students have to major in biology. With the exception of law, it's a widely held misconception that pre-professional students pursuing admission to any medical, dental, pharmaceutical, or therapeutic professional program should also major in biology, chemistry, and kinesiology or sports science are also often believed to be among required pre-professional major options. Let's look at this a little more closely and the impact that it's going to have on pre-professional students. So students from all academic majors are admitted to U.S. medical schools. Admissions committees value applicants with a diverse range of educational backgrounds and experiences. Students are more likely to excel in academic areas that they enjoy. Because competitive grades are critical to being a successful applicant, students should be encouraged to study the major of their choice. While certain prerequisite courses are required to apply, these courses can be woven into any curriculum. Success in high school does not guarantee success in college. And a major you're more interested in and naturally good at will allow you more time to devote to prerequisite courses, extracurricular activities, and MCAT prep. So as I said, prerequisite courses can be woven into any curriculum. I think the biology, chemistry, kinesiology, sports science majors tend to be the logical choice because they incorporate a lot of the science courses that are prerequisites for these professional programs, but they're not required. Any major can have a minor in science or electives that can be worked in. Some students will do their prerequisite courses completely separate from their undergraduate major or afterwards. It's not that you have a science background, it's that whatever background you have, you excel in it, you're excited about it, you've done well. And so it's detrimental to assume that you need to follow that science background to get into these programs. As you can see, who gets into medical school? Non-biological science being the leading number, followed very closely by humanities and social sciences, then bio, and then other non-science fields and health. All right, so another myth, you'll need knowledge of upper division science in order to do well on the MCAT. It's another reason a lot of people think you need to major in biology or chemistry or these sports science programs. According to the American Association of Medical Colleges, you only need an introductory knowledge of physics, biology, organic and inorganic chemistry, biochemistry, psychology, and sociology for the MCAT. Number two reason you don't have to major in biology or another science, you don't need to prepare thoroughly for the MCAT if you're doing well in your prerequisite courses. Not true. Nearly 50% of all MCAT test takers sit for the test a second time due to inadequate preparation the first time, many of whom also have high scores and grades in prerequisite courses. So being a biology major, chemistry major, or being exceptionally good in science does not automatically mean that you're going to do well on the MCAT and don't need to prepare. The MCAT tests science skills. There's no need to worry as much about the verbal section. Good reading skills are extremely important for the MCAT, even in the science sections. Humanities majors actually outperform biological science majors on every part of the MCAT, not just the verbal section. In fact, medical school admissions officers weigh the critical analysis and reasoning section the heaviest of the exam because they view it as a measure of a student's ability to learn and communicate. There is a magic number that you must score on the MCAT, even in the science sections. That's another reason we should major in science, right? Total scores for the MCAT are centered at 500 with ranges from 472 to 528. Your score alone will not predict your acceptance or rejection from a competitive medical school. There are a wide range of scores that are deemed acceptable, and admissions officers will look at other application elements before making a final determination. If your MCAT scores are lower, you'll most likely need a higher GPA and a more substantial clinical research record to compensate. So especially for students who maybe are not extraordinarily strong in science, but still want to pursue these professional programs, the idea that you have to major in biology or chemistry or some type of sports science is really dangerous. Focus on those science courses, but as far as your undergraduate major, again, pick something that you feel very passionate about, excited about, and feel like you're going to excel in. All right, so myth number 2, GPA is the only thing that matters when applying to professional programs. Students often make the mistake of assuming that their GPA alone or their GPA and score on any of those required standardized exams will be what is weighed to determine admission or will at least hold more value than other elements on their application. Not true. So here are the 6 key components of professional program applications, many of which are just almost as valuable as those GPA and exam scores. So obviously, number 1, yes, academics. Admissions officers want to know that you can handle the rigor of the program as well as the lifetime of learning involved. While it's not the only factor, it is likely the first thing that they will look at to judge an applicant, which makes it imperative that you have the academic record and test scores that portray you as capable of handling and excelling in the program or school you've applied to. Grades, academic honors, difficult coursework, and good test scores will all contribute to your record and how you're evaluated for admission. 1 or 2 bad grades are not deal breakers. Programs often love to see an upward trend. Your record does not have to be perfect, but every semester and course count. Do not assume that your freshman year, your first semester, or any specific course is not important. Number 2, observation and clinical experience. So professional programs want to see as much as is feasible that you've tested your desire to go into the field you're pursuing. This is where clinical experiences and observation are key. Clinical volunteering, shadowing, research, and employment can all give you experiences that are vital in confirming your interest and in learning if you're able to handle some of the more difficult aspects of the job in addition to the fun and exciting ones. Shadowing one time or volunteering once a month for a semester will not make you a strong applicant. Start these clinical experiences early in your college career and continue them. Not only will a record of continued clinical experiences make you more attractive to admissions officers, it's going to give you things to write about in your personal statement and secondary essays, as well as experience to talk about in admission interviews. All right, number 3, intellectual curiosity and research. Program admissions representative want to know how well you're going to contribute to a profession that's always evolving and where new and continued understanding is vital. Involvement in research is a great way to demonstrate your commitment to furthering knowledge, especially for programs in medicine and science. Research can take many forms. Bench lab research is the most common, but clinical research, bioinformatics, and public health research are all common as well. As with your major choice, follow your instincts. The best research is research you are genuinely driven by. If your passions are in economics, anthropology, or anything else, follow those instincts. Commitment to service. Work done by those in these fields is first about service to others. Admissions committees want to know that your desire to be in the field is genuine and for the right reason. Along with clinical experience, it's crucial to demonstrate a commitment to service through the other activities you participate in. Long-term volunteering and involvement in causes you're passionate about is a great way to show admissions committees that you're driven to help others. A common misconception is that this commitment to service should be demonstrated through activities and organizations related to medicine and the healthcare field. Students should pursue non-medical volunteer work or experiences. Medical schools are not looking for you to pursue any one type of volunteering or service. They just want to see that the experiences in which you have invested time are meaningful to you. Personal characteristics. While it's difficult to put onto an application, here are some of the personal traits that professional programs look for in their applicants. Empathy, the ability to adapt to challenging circumstances, self-awareness, intrinsic motivation, discipline, maturity, and teamwork. There's not one best way of showcasing these traits, nor is this an exhaustive list. Think about these or other personal characteristics you possess as you write your personal statement or secondary essays, and identify which of them you can reflect in the experiences you write about. Personal interests and passions. So again, admissions officers are not looking for applicants who have no passions or interests outside of their professional discipline. Keep doing the things that make you who you are. It will differentiate you from the many other applicants you're competing against for a spot in your desired program. Your personal passions and interests, whatever they may be, dance, teaching, poetry, history, hiking, etc., will all contribute in surprising ways to the professional you become. Okay, so what are more myths and misconceptions? Students who do not graduate in 4 years or opt for a gap year are less competitive. Not true. Many factors contribute to the pressure students feel to complete their undergraduate degrees in 4 years. Family expectations, growing student debt, transfer processes, working to support yourself, research opportunities, internships. Professional programs value life experience. They're not going to look at a gap year or an applicant who's not coming right out of college as a negative. If I started a community college, I'm less likely to get into a professional program. Again, wrong. 28% of admitted medical students have taken courses at a community college at some point, whether that be to get started in college, complete an associate's degree, or finish prerequisite requirements. Ultimately, the idea is that what matters most to medical schools, dental schools, therapy schools, any professional program is how well you do in your courses, not where those courses come from. You can repeat courses that you don't do well in. This is one that I hear a lot. Repeats, grade replacements have become kind of a crutch for a lot of students, and it's fine in some instances and where programs allow students to take courses and accept the higher of the attempts. But in a situation like a professional program, it's not going to work. Once you take a class, it's on your record forever. While you may be able to replace the course at your original institution, the pre-professional program is going to average all attempts to evaluate your performance. So don't enter into a class thinking, if I don't do well the first time, it's okay, I can take it again. Because once it's on your transcript, it's there. And these colleges are going to get all of your transcripts and average all of your grades for a cumulative GPA and often those prerequisite course and science GPAs. All right, so any questions? Ashlyn and I are here.
Sorry, I had a question. Can you guys hear me?
Yes.
Okay. So, about I think I just touched the screen. I didn't mean to do that. But about the repeating a course. So, I originally went to a university for a different major. It was like a completely different major, like unrelated to medical of any form. So when I decide to like apply to medical schools, will those be on my transcript?
Yes.
Okay. Thank you.
Yep. Everything, once you take courses, they're there. So even if you don't send them a transcript, they're going to know where you went to school. It's part of it's like what we call a clearinghouse. So it's always going to be on your transcript, and they're going to you're going to have to send everything, and they're going to average all of your grades together, even grades that might not have transferred. So let's say you took a class at a university and you didn't get that C or better that is typically required to transfer credits. They're going to get that original transcript, and those grades that did not transfer will actually still be averaged in as well. So if you took a class, whether it was an original attempt or a grade replace or repeat, it will be considered.
Okay. So that will go into your GPA, your final GPA.
Yes.
All right. Thank you.
You're welcome.
I'm not sure if you mentioned this already, but is it advised to meet with you guys beforehand, like while planning for our next classes or anything, as like pre-professional majors?
Yeah, definitely. And, some schools, especially once you transfer, a lot of universities will have actual pre-professional advising centers who will work with students that have identified themselves as pre-med or pre-dental or pre-PTO, TPA. But definitely let your advisor, if you have an assigned advisor or if you're just seeing somebody in the advising center, make sure they know that that's the track that you're on. Take some responsibility and go ahead and be motivated, look up those prerequisite courses if you haven't already, come to the meeting with that information. They can assist you with that as well. But yes, you should definitely tell them that, and they can help you in making selections along your transfer pathway and working in those prerequisite courses, or working along the guidelines of the major that you're ultimately hoping to go into at the university so that you can continue on to that professional program. Knowing that that is the end goal is very helpful. So yes, definitely share that.
Okay, thank you.
You're welcome. Any other questions? Ashlyn, do you have anything you want to add?
I don't, other than we got off pretty easy today, if those are the only two questions. Just for our students that are here and future students that will listen to this presentation, hopefully, you guys kind of figuring out, like Heather said, you guys figuring out what your end goal is helps us help you. And so I know a lot of you have big dreams. There's a lot of great opportunities out there, and doing your research ahead of time will really put you ahead of students that are just like you. So we're here to help. And I know we threw a lot of information at you. This will be available to watch again on our Wake Tech advising page. So we'll make sure that you guys get the link to that just so you can revisit the information because I'm sure it's overwhelming. So
it is. Yeah, it is a lot of information. If nothing else, if you took nothing else away from this presentation, it is overwhelming, and that's why it's important to start researching and looking at this information early and communicate. Let your advisor know. It's a lot of things to look at, to think about, and if you try to do it all by yourself, it's very likely you are going to miss something or forget about something. So the more help you can get in preparing as you go along your pathway, the better. So communicate with your advisor, plan, motivate yourself, look for experiences, and you'll be on a good track.